for you today. Why? This is the ultimate drive time experience. Home run.
That's right. Hashtag home run with and MVP Sinai in the hood.
Yes, sir.
And as we had mentioned earlier, it's time to actually look into our health for a moment. We know that we might be fine, there aren't any aches. There is no reason for you to go to the doctor. But it's always important to make sure that you get a health checkup. Since it is the start of a new year, many young people are always calm about it, but we need to make sure that we actually check on ourselves. Today, we're joined on the line by Dr. Busi Kabane-Bailey to talk about the best ways to start the year on a healthy note, from mental well-being, preventative checkups, to making safer choices and knowing when to ask for help. Also, Dr. Busi Kabane-Bailey is a medical doctor and systems innovator with a strong background in primary healthcare and social innovation. Trained at the University of Cape Town, she has extensive experience in evidence-based non-profit interventions. She currently serves as innovation director at the DG Murray Trust, where she drives initiatives that tackle the social determinants of wellness and expand equitable access to opportunity. Dr. Busi Kabane-Bailey, welcome to Home Run.
Hi, thank you so much for having me.
Thank you for joining us. We just want to give you a round of applause after reading your bio.
Wow.
Yay! Thank you so much for working for the community and also doing what you can in the healthcare space. Let's start with the medical point of view. How can young people start setting goals in a way that supports their mental health as well as their physical health, rather than increasing stress, sleep problems, or anxiety and assuming it'll just go away eventually?
Right, so I think the biggest thing is that prevention is better than cure. And so the first is move your body, whether it's taking a walk, whether it's running, whether it's joining a gym if you can, or doing aerobics from YouTube at home. Moving your body is a great first step to ensuring your physical and mental health. But more importantly, be connected with your loved ones, your friends. Start the year with a little bit of ease. We all, have resolutions, and I know matric results just came out, and so there's lots of stress surrounding that. So it's really important to take care of your mental health, talk to the people you're connected to, and start the year with some ease.
Now, Dr. Busi, Ayanda mentioned earlier on that even though as youngsters we might not feel any aches or pains or anything like that, why is preventative healthcare, and that includes your mental health check-ins, your sexual and reproductive health and routine screenings, so important?
So preventative health is very important because a lot of the conditions related to mental health and lifestyle conditions come on very silently. And so you'll feel like yourself, you feel like you're okay, but you could have a high blood pressure from stress, and high blood pressure causes strokes and can kill. And so it's important to start with prevention. And then also on the mental health side, there are people who can go to work, be with the people that they're in relationships with, but they're struggling internally. And so, again, a silent condition that really impacts people's lives. And so that's why we try to take a focus on prevention. And so we want you to meet doctors when you're well so that you can prevent disease from happening.
Doctor, alcohol use is also common among young adults. And medically speaking, how does alcohol affect the developing brain and body? What are the short as well as the long-term health risks of heavy drinking?
So absolutely, you're right. Alcohol affects developing brains. So young people, your brain is not fully developed until you're 25 years old.
Wow.
So, 25, your brain is still developing. And so every time you drink, your frontal cortex of your brain, which affects your behavior, your personality, your cognition, takes a knock. And so you can imagine if you start drinking at 16, how much of a hit you will have experienced by the time you're the age 25. But more than that, alcohol affects all the systems of the body. It can lead to liver disease. It can lead to kidney failure. Recent research shows that it's a class 1 carcinogen, so which means that the same way that smoking can cause cancer, alcohol also causes cancer down the line. Wow. And so it's a really dangerous substance. And I think more and more people are beginning to become curious about sobriety and what does it mean to live a sober life? What does it mean to be at the braai and decline the beer? because, alcohol just doesn't sit well with me. And my encouragement is for more young people to explore sober curiosity. Think about, what does it look like for you to go out and have fun with your friends and not drink and feel good the next day and have a full, functional, productive day after that.
Wow. Dr. Busi, now another thing that we're seeing that is rising commonly amongst young people is stress and anxiety and burnout. Like, and we want to find out from a health perspective, what impact does constant pressure have on the brain and mental well-being? And when should us as young people should maybe just decide to seek professional help?
Absolutely. I think the pressure and the comparison that we're living with in 2026, social media portrays people's lives as being fantastic. They're going on trips, they're getting married, they're buying cars, they're buying apartments, they're tinkling the keys. And so it gives young people the impression that everyone else is doing better than me. And that kind of pressure is immense on young people, and they don't know the reality that the majority of South Africans are actually struggling. A lot of South Africans are actually living in serious debt to try and maintain these lifestyles. And so the first thing I would say is you need to look at your social media intake, because that really drives who you think you are, what your goals are in life, and that can reduce some of the stress and the pressure related to what young people are experiencing. But also just look into yourself and figure out that you are on your own journey. No one has lived the life that you're living. And so I say cut down on some social media time, be in the present with your family, your friends. When you're at school, varsity, lean in, join a social club, join a running club. Because I think in 2026, that's what we're going to see, is a lot of people coming offline and being present.
Absolutely. I agree with you there. And a lot of us have started already. One last question from our side. How can young people establish relationships with their healthcare providers? Or how can we foster open and honest conversations? Because sometimes you might arrive at the doctor and you're really scared to talk about what's going on, what's good.
Right. No, it's absolutely true. So we know that your everyday South African can reach a health professional through the public health system, but we know that it's overburdened, there's long lines, and sometimes it's difficult to talk to some of these older nurses, matron that are judgmental. And so we have an initiative like Keready, where you have doctors on the other side of a WhatsApp line where you can ask any health question, whether it's how do I start my diet, or something's burning down there and I don't really know what to do. And they're happy to answer those questions. And I can give you their WhatsApp line number. It's 060-019-0000.
Please repeat it again, doctor.
Absolutely. So it's Keready WhatsApp line for your health-related questions, which is 060-019-0000.
Thank you so much, Dr. Kabane-Bailey. We really appreciate this.
It's a pleasure for having me, and hope you have a great day further.
Definitely, you too.
Cheers.
Rev up your engines and turn up the volume. It's Home Run.